Begin this skill by knocking and identifying the patient by name. Introduce yourself and inform the patient that you will be emptying the urinary drainage bag. Close the curtain, wash your hands, and gather your supplies. The supplies you need for this skill consist of a triangular graduate container to collect and transport the urine, a chucks or barrier to place on the floor under the urinary drainage bag, gloves, and an alcohol swab. Place the chucks on the floor under the drainage bag and open the alcohol swab before you get started. Put on your gloves. Ensure the catheter tubing is not kinked or touching the floor. Remove the port from the sleeve on the bag carefully, not allowing it to touch any surrounding objects. Open the port by sliding the valve into the open position, being careful not to touch the lower end of the port near the opening. Position the open port within the graduate container and elevate the bag with your other hand so that urine flows into the container. Be very careful to maintain complete control over the port at all times, not allowing it to touch the inside of the container or any other surface to prevent the spread of bacteria. When the bag is empty, carefully close the port by sliding the valve into the closed position, being careful not to touch the lower end of the port. While holding the port with one hand, pick up the alcohol pad with your other hand and clean the outside of the port. Roll the alcohol pad into a tube and insert that pad into the open end of the port to remove any bacteria that may have entered the port during the procedure. Carefully slide the port back into the sleeve without allowing the clean port to touch any external surfaces. Ensure the catheter tubing is not kinked or touching the floor. Wrap the chucks around and over the top of the urine container for transport to the toilet to prevent spills. Set the urine container, wrapped in the chucks, on the lid or back of the toilet to prevent contamination of the surface with any urine that might be on the outside of the container, and unwrap the chucks. Bend down to measure the urine at eye level. Do not hold the container up to eye level because it may spill, and it must be on a flat surface for an accurate measurement. The measurement must be made in cc's and may be rounded to the nearest 50 cc line, either up or down. Pick up the container and throw the chucks and the alcohol pad away. Lift the lid of the toilet and pour the urine into the toilet. Rinse the container in the sink and pour the rinse water into that toilet as well. Set the container down into the sink to disinfect. Spray the container with the disinfectant provided. Use a paper towel to pick up the container because your gloves are contaminated and the container is now clean. Dry the inside with a paper towel and discard. Dry the outside with a paper towel and discard. Use a clean, dry paper towel to open the drawer to put the container away to prevent contamination of the drawer with your soiled gloves. Finally, throw the paper towels away and remove your gloves. Ensure the catheter tubing is not kinked or touching the floor. And give the patient her call light and open the curtain. wash your hands, and document the skill on the documentation sheet provided. Review your skill and make any corrections. Finally, tell the evaluator that your skill is done.